Thank you for joining us for this segment of the Mental Health Series presented by Intellios, which includes the American Registry for Diagnostic Medical Sonography, ARDMS, the Alliance for Physician Certification and Advancement, APCA, and the Point of Care Ultrasound Certification Academy. Your mental health is just as important as your physical health, and even more so when you are in the middle of a crisis, dealing with new challenges and uncertainty. The well-being of our healthcare professionals is critically important to us, which is why we created this mental health series. We want to help take care of you so that you can take care of your patients, your friends, and loved ones.
Hello, and welcome to today's webinar. I'm your moderator, Dale Sear, CEO and Executive Director of Intellios. Before we get to today's presentation, there are a few things we have to cover first. Today's webinar is scheduled to last 1 hour, including some time for questions and answers at the end. The webinar is approved for 1 free AMA Category 1 CME credit or 1 free SDMS credit for SDMS members only. And to claim your credit, we will provide a survey link at the end of the webinar. Viewers can submit questions for the presenter through the chat box on YouTube Live. Staff members are monitoring the chat. The webinar is being recorded and will be posted on the ARDMS, APCA, and POCUS websites for on-demand viewing after the event. Plus, we have additional mental health resources that are available on our websites. As a disclaimer, I would just want to emphasize that this webinar is for informational purposes only and is not intended to provide medical advice or be a substitute for medical advice, diagnosis, or treatment. Now, I'm very pleased to introduce today's speaker, Dr. Albert Wu. He joins us to discuss leadership in a crisis, particularly in this challenging time of COVID-19. Dr. Wu will share his perspectives on how healthcare professionals can help themselves and their colleagues by establishing mental health supportive structures that promote practice stability and practitioner resilience for the future. Dr. Wu is a practicing general internist and professor of health policy and management and medicine at the Johns Hopkins University Bloomberg School of Public Health. He is also director of the Center for Health Services and Outcomes Research and online Master of Applied Science in Patient Safety and Healthcare Quality. Dr. Wu is an expert on quality care and outcomes research with over 450 publications. He is also co-director of the Resilience in Stressful Events Peer Support Program for Johns Hopkins Medicine. Albert, thank you for joining us today. We're excited to have you. Please take it away.
Thank you so much, all of you, and I'm very pleased to be able to join you today, however remotely. Could we have the first slide? We're going to talk about how you, as individuals, can work to lead your institution, your colleagues, and yourselves through these stressful times. Next, please. Our learning objectives are here to define mental health challenges in the healthcare community and the needs of coworkers and colleagues, to describe some of the mental health needs of, in particular, of those caring for patients with COVID, to explain a little bit how to manage those mental health problems, and more importantly, how to practice and sustain resilience, maintain happiness if possible, and mindfulness. We also are going to identify some leadership tools to help create a supportive environment wherever it is that you work. Next, please. I do not have any relevant conflicts to disclose. Next, please. So this is how we as providers have come to be perceived. I don't think prior to this spring, many people viewed me as a hero, much less a superhero, on a regular basis, but we've really gotten a lot of positive feedback from the media and for the public in general. And they imagine that it must feel pretty good to be striding down that hall with everyone bowing down to us. Next, please. However, COVID-19 is shaping up to be the defining health crisis of our generation. Healthcare is already a really high risk environment for workers. I think people don't think so much about that. They think that perhaps doing building construction is high risk, or working in a steel mill, but healthcare is really a risky place to work. And that is before we even got into COVID. COVID is now really straining healthcare staff. Patient care for the first time really carries with it personal risk of infection, and in many ways threatens the emotional well-being of everyone who is trying to deliver that care. Next, please. In the short term, there are many obvious risks and, in fact, harms to healthcare workers. People are naturally afraid and anxious for themselves and for their families, and are off balance by shifting roles, having to work in different settings, being redeployed to unfamiliar areas. There's been quite a lot of anger and frustration about the fact that that everything isn't set up ideally, that there may not be sufficient protective equipment to assure them being safe at work. And even when the equipment is there, it can be pretty bruising, literally. There is terrific anguish and grief from many patients dying. And there's a real particular sadness at seeing very sick patients spending their last days separated from their loved ones in isolation. In the longer term, there is a real risk for burnout, accelerated burnout, and also the worsening of existing mental health conditions, which are quite prevalent in healthcare workers. In some cases, there are the sum total of all of these traumas is developing post-traumatic stress disorder. Next. This is terrible, a terrible burden for healthcare workers. This also threatens the mission of our healthcare organizations and our practices. This level of distress can be truly disabling. Even a little added stress can reduce our performance. If you are performing procedures every day, that can really make a crucial and dangerous difference. There's a tendency towards more absenteeism, more call-outs, and even when people are not absent, there's the threat of presenteeism, people showing up who you really would be much happier if they'd stayed home. All of this can threaten the institutional response to the pandemic. Next, please. It turns out that there are a set of predictable phases of the psychological response to any disaster. This chart that I'm showing here has been used for more than 30 years. And in many ways, it's the sum total of observations from dozens, if not hundreds, of disasters of many kinds: hurricanes, earthquakes, tsunamis, but also pandemics, some of the earlier pandemics of the last couple of decades. On the vertical axis is the emotional state of workers and of the population in general. In some cases, in a disaster, not surprisingly, there are real emotional lows. There's also the potential for some positive emotions too. For our purposes, there are 3 or 4 really important phases of the response to disaster. The first is the impact phase, and perhaps the pre-impact phase, which is characterized by anxiety, worry, and waiting on pins and needles for what is going to come. There's a lot of self-protective behavior. People are anxious and may have anxiety attacks. They're waiting for the pin to drop. The impact, of course, can be very upsetting and can cause anxiety and fear and depression. And then things enter a new phase, and perhaps more the positive, heroic phase. People realize that they've got to get the work done. They pull together. They are running on adrenaline, and there are new bonds formed and new collaborations. This is really, this can be an exciting and even exhilarating phase of work. Things begin to happen. It's a lot of high-fiving all around. People feel like they can do it. We've got this. And this can culminate in a honeymoon phase where people are feeling pretty good about themselves. This typically occurs during COVID at the time of the greatest burden or shortly thereafter, when you finally got all the routines down, all the protocols, and you can do this. Thereafter, there is a gradual slide into a long trough of disillusionment. The peak of infections may have passed. Reopening has begun. There are fewer resources and fewer supports. There are now some of the consequences from some of the economic aspects of the pandemic. Organizations and practices have lost billions of dollars, and there is the necessity for layoffs or furloughs. And people are now concerned about other things, childcare, more practical aspects of life. Reality is setting in, and this is when people get cranky, cynical, truly depressed. This is when suicides occur. And this phase of emotional fatigue and really burnout in many ways can last for months or longer. Gradually, things begin to reopen fully. This might happen, I'm not sure when it would happen, I don't have a crystal ball, but maybe next year. And this is a restoration or recovery phase, and things gradually return to normal, albeit a new normal. Next, please. So the needs of all of us can be described and have been well described by this familiar diagram to many of you, Maslow's hierarchy of needs. We all have these needs, and some of them are very basic and really come first. We have basic physiologic needs and safety needs for food and water and safety. We have psychological needs for love and belonging and self-esteem. And we have self-fulfillment needs, which may not apply so completely to a pandemic situation, but feeling like one is achieving one's potential and getting things done. Next, please. During the pandemic, some of those basic needs are really threatened. People have been working so hard, they forget to do a number of rather basic things, eating regularly or healthily, getting enough sleep or rest, getting exercise. And to compensate for this, some of the best health systems or the most responsive have provided meals, even hotel rooms for hardworking staff to isolate themselves if they're afraid of going home and spreading infection to their families. There are also new demands which fall under the sort of activities of daily living. How do you get back and forth? Is this costing you extra money? What about childcare? This is an increasing concern. Getting groceries and getting protective equipment and supplies has been an incredible headache. After working for a 12-hour shift, you could head home and stop at 4 grocery stores in search of toilet paper. What our hospital has done is to begin to provide many of these things in the hospital. We set up a grocery store and with a stock of essential staples and also cleaning supplies and protective equipment. Next, please. Worker safety, I will not talk about so much, but certainly people need adequate protective equipment and, importantly, how to use it. Next, please. perhaps more importantly for this discussion are the psychological needs. And in this case, it is very important to understand that communications in crisis leadership and communication are not the same as everyday communications. When there's an emergency, when people are in a fight or flight state, it reduces them and it reduces their ability to think rationally. They begin to think more with their instincts and with adrenaline. They're really thinking about self-protection. They are less able or willing to accept information or accept orders from authority. In order to get around this, it's important to first listen and accept and normalize the feelings that people are conveying to you. This, if you lead a larger organization, this is something that you need to do as a top leader or manager. If you're running a practice or are simply listening to your colleagues, these are things that you need to do too. It's important to communicate often and honestly. If there's good news, you should convey it. If there is bad news, you should also convey it. And it's very important to convey an optimistic message, to focus on the group and group cohesion, what you are accomplishing together, and on building resilience and explaining that what you're doing is attempting to then maintain both the resilience of the organization and of the individuals that make it up. Next, please. We have developed 4 pillars of resilient leadership. The first is expressing a hopeful vision of the future. People are really in need of information and really yearning for a leader who can tell them where things are going and what they should do. Being able to be optimistic and explain that there is a plan and describing what it is with potentially with timelines can be a great comfort. The second is to be decisive. There is never a perfect time to communicate, but waiting too long may be worse than not communicating at all. So when able, come to a decision, make it, state that a decision has been made, and explain why this was done and what is going to be done. Using structured communication can help, and communicating in a way that is timely and transparent and truthful is crucial. Again, remember that people listening to you are running on adrenaline, are in a fight or flight mode much of the time, and can be reassured by what you tell them. But people's BS meters are dialed up pretty high. If you are not walking the talk, if you are not saying things that they know to be true, they will quickly become distrustful. So you need to model behaviors that foster trust. And if you say that everyone should wear a mask, you better be wearing a mask whenever you're out in public. It's amazing how top leaders fail to recognize these 4 pillars of resilient leadership. Next, please. I'll give you a brief example of what we've done at Johns Hopkins Medicine. And I'm really going to talk mostly about our efforts to provide staff support. We have managed to develop an integrated continuum of support, which ranges from well-being to caring for frank psychiatric problems. This was a pretty unprecedented collaboration among a number of entities within the organization that previously had not worked so much together. Like many things in our organization and many organizations, things grow up organically and operate in silos. So this involved our Office of Wellbeing, that runs a Healthy at Hopkins, basically preventive strategy. Spiritual care, including all of the chaplains of different denominations in the hospital. RISE, which stands for Resilience in Stressful Events, a peer support program that I'll talk about a bit more. My Support, which is really our employee assistance program, and our Department of Psychiatry. We put all of our resources and contact information together on the back of this postcard and handed these out to people and explained something that they all realized: this is difficult for all of us. You may need to talk to someone. Here's how to get to that person. Next, please. All of this was put together on a specific page for COVID-19 support resources on the site for our Office of Wellbeing. That included how to get your basic needs met, which I discussed briefly, the mental, emotional, and spiritual supports that we're focusing on, in addition to some other programs, including some physical activity programs that ran, of course, online throughout the pandemic. Next, please. Healthy at Hopkins has a coordinated wellness program, and this has often involved things like group walks and competitions, yoga classes, instruction on healthy eating. This was expanded to include very basic support, including providing childcare and food for staff. Meals were donated by organizations all over Baltimore, which was quite heartening. Next, please. Spiritual care really wound up playing a critical role in staff support. Not everyone has religion, but for many people, it is really a foundation of their lives. Spiritual care began to round regularly in the hospital. They often would gown up and don full protective equipment and go into the units to support and comfort staff, as well as patients and families that were very ill. They've been quite well known, particularly for palliative care and consults, and many people welcomed them. And they were one of the few groups that was in the hospital doing support face-to-face. Next, please. RISE, or Resilience in Stressful Events, is a peer support program that we have run at Johns Hopkins since 2011. It's led by Cheryl Connors, who's there in the middle, Matt Norvell, who is the lead pediatric chaplain for Johns Hopkins, and myself. RISE is a group of trained volunteers who provide peer support. All of them work in the hospital. And at the beginning of the pandemic, there were 35 of these individuals who rotated on call and would respond to anyone who paged or called and asked for someone to talk to. We expanded our activities and began rounding proactively on key units, particularly if we knew that they were having difficulties or were transitioning from perhaps a normal unit to a COVID unit. We also trained an additional 30 plus responders, and we now have a very large group of over 70 people who are ready to respond to calls. This program has actually been adopted by the Maryland Patient Safety Center and has been spread to other institutions initially around Maryland and around the country. I think something like 40 hospitals and health systems now have RISE programs that are doing similar work around the country. Next, please. My Support is, again, our employee assistance program. They went to full virtual mode, but one thing which they did, which was very helpful, was they maintained a 24-hour phone line, and they would talk to not only staff, but also to family members who were stressed out, perhaps because we were stressed out. And there were certainly enough things that there's certainly enough stress to go around. Next, please. So support is fractal. And that is to say, some of the principles that apply at an institutional level or a unit level or an office level or even within a pod of workers or a family, I think some of the same principles apply in all of those cases. Next slide, please. So what should we do as individuals, and what should we encourage in our colleagues and perhaps our families? Well, I think we can look back at the same pyramid that Maslow pointed out for us. The first thing to do is really to think about basic needs. Something which it's crazy that we need to remind people to do this, but remember and be sure to eat regularly, good meals, to drink and hydrate yourself regularly. And drink does not mean, in this case, does not mean drinking in a bar. And get enough sleep, and also get enough rest. I think that it's important both literally and perhaps figuratively to give yourself a break. Those of you who are spending some of your time working at home shouldn't think of yourself as working at home and beat up on yourself for not getting enough done. You should really think of it as that you are at home during a pandemic trying to get some work done. Otherwise, it's too easy to compare yourself to everyone who seemed to be writing novels and running marathon distances and taking care of baking bread, sourdough bread at home, and teaching themselves to ballroom dance. You can't compete. A very important thing to do is to do something that you enjoy. And that something should really be something that you uniquely like to do, something you know gives you pleasure. What are the things that you do to make yourself feel better, to make yourself, to restore yourself a little bit? It might be exercise. It might be listening to music. It might be taking a walk. It might be something that I've heard more in the last 3 or 4 months than I'd heard ever before, but it might be simply sitting in your car quietly and listening to music, or looking at your phone, but just getting away to a quiet place that is all just for you. Exercise can be something that both keeps you in shape, that prevents you from gaining the COVID-19, as some people complain about, the 19 pounds that you gain while you're locked down on COVID. And when you're talking to your colleagues and they are particularly upset, one thing you can do is help them think about the internal resources that they possess. What is something that you do that you enjoy? Is it playing with your dog? Is it taking a walk in nature? You can advise them to do that and to give themselves a break. Next, please. So psychological needs are next up on the list. And it is important to understand that we are social beings. And so the lockdown and the isolation that we are subjecting ourselves to is a form of self-punishment. Solitary confinement is one of the worst penalties that we can impose on someone for a crime. In many ways, many people who live alone, in a way, have been sentenced to solitary confinement for much of their life This can be very depressing and alienating. So it's important to reach out to friends, and as well as to get in contact with family and loved ones. I think that the multi-party Zoom call has become something that has really gained prominence in all of our social lives. This is a slide from the Hollywood Squares, which you may recall. Who remembers Charlie Weaver and Paul Lynde? If you do, you're probably closer to my age than some of the others. But staying in contact, reestablishing bonds can be both refreshing and simply important to maintaining a positive attitude. Many people have taken the strategy of buddying up, and that is finding someone from some other part of your life. They don't need to be in the city that you live in anymore. They can be anywhere in the world, perhaps, but to pledge to keep in contact with each other. Some of the buddies that I know of talk to each other or contact with each other every day and update each other on what they're doing. Try to help them keep a routine and give support when it's needed. It's important to check in with yourself, not something that we normally do. We can be pretty oblivious to our own problems. Typically, when I am getting cranky, I'm never aware of it, but my wife will say, "You ought to go and get some exercise," which means you're getting pretty cranky. It would be better if you were doing that and weren't right here in the kitchen right now. But you can check in with yourself at the beginning of the day, at the end of the day. Try to get a little bit in touch with how you're doing and how you're feeling. You might be surprised at the answer, but self-honesty is important. Next, please. Psychological first aid is something that I believe should be the new CPR. One of my colleagues, George Everly at Johns Hopkins, has a course on psychological first aid. It is on Coursera. It's one of those MOOCs, massive open online courses on psychological first aid. And if you put in Everly and psychological first aid or PFA, you'll get the course. It's only about 8 hours long and is free. Something like 250,000 people have taken the course since March. This is something, though, that you can do with your family, your friends, your colleagues. The most important thing is listening and being present. And then important, but really less important, is assessing what needs are, trying to make some priorities, and perhaps intervening. I will say that the most important thing is really being present, showing up, being non-judgmental, and listening. Next, please. Being positive, and the flip side of that, reducing toxicity, is something that we all could benefit from. There is all too much bad news today, and there is no shortage of that bad news online and in the media. A strategy is to limit media exposure, including social media exposure. This slide here says, time limit, you've reached your limit on Facebook, ask for more time. On Facebook, you can see the beautiful cake that someone just trained themselves to make, their beautiful family that they're spending so much more time with, and also all the extra things they've achieved, or alternately, all of the frustrating, infuriating, truly stupid things that are happening around us. There's so much selfishness, you that is on view that you really just want to jump out of a window sometimes. Turning it off and doing something more constructive is helpful. When you're talking to people, I think it pays to be a little bit extra constructive and kind. We're not always so good at doing that. We're much better at criticizing than we are at constructive criticism. Listening more before we react and try to fix the problem that is being presented to us. Complimenting others. This is something which I think many of us are not in the habit of doing, but which always makes people feel good. Trying to be a little bit more kind and a little bit more understanding. If you're talking to someone and they give you some attitude that you maybe do not love, I think that rather than sniping back, a strategy is to hold your tongue for a second and realize, things are pretty difficult for everyone. I don't know what this person is going through. And just saying, yeah, things are pretty tough for all of us, aren't they? Next, please. Actually, could you go back one? Could you go back one more? Someone in the chat just asked for the link. Again, if you get onto the Google and just put in Everly and psychological first aid, this will pop up. But you can go to https://coursera.org/learn/psychological-first-aid/. Next, please. And next, please. So it can feel kind of frustrating these days as far as fulfillment needs go. We can't do all of the things that we were able to do before. We're distracted, and things are just slower when you've got people running around the house that need to be fed and watered and loved and given attention. I think that being more charitable is helpful. First of all, I think that you should take a minute to recognize that you are doing important work under a significant duress. Honor your service and do the same in recognizing your colleagues and what they do, the efforts they're making. People are really doing heroic work in dedicating themselves to take care of very difficult and very sick patients. Something to do whenever possible is to emphasize the group and what it is accomplishing. You are doing this together. Remind people that they are part of a legacy in healthcare and medicine of excellence and compassion, and you are doing the best you can to make this happen, even during what has been a terrible crisis for all of us. Something a little bit of a silver lining is that we've gotten a chance to do this with many people who we have perhaps not appreciated as much as we should have in the past. That includes our professional staff, but also some of our less visible non-professionals, the people who perform essential tasks to keeping us from contracting COVID, the cleaners, the laundry people, the people who've transported patients, facilities workers, in the hospital, food service workers, and cleaners. These people are doing difficult work, putting themselves at personal risk. And it's all part of the COVID response that's perhaps the most important thing for all of us right now. Next, please. This is a wall outside of our medical intensive care unit, adult medical intensive care unit. And you can see that these people have pride in their own work. This is something which has really helped sustain them during a very difficult time. And I would encourage you to take some pride in your own work. You're doing important things at a very difficult time, and you should give yourself a little credit for it. Next, please. in summary, staff, which includes us, who are working during this pandemic, are understandably anxious, fearful, off balance. Many times they're deprived from the networks that they are accustomed to seeing and using for support. I talked to some vascular surgeons recently, and many of them said that the thing that they missed most was coming into the office while elective procedures were shut down, and working with their staff. This is confusing. People are angry in general and can get angry for not any particularly good reason at others. And people are sad. It's really important for healthcare institutions and for all of us to provide support to each other. Practitioners can employ strategies to meet those needs, and should be thinking about all the different levels, from the very basic to the perhaps more higher levels of fulfillment. I think that all of them are important, and we need to keep those in mind. So that's it for my formal remarks. I think that you are all doing amazing work. Your services are greatly needed, and perhaps more needed now as the backlog opens up. There may be future waves of this pandemic, but if you can take care of yourself, you'll do a better job of taking care of all of the people that you're supposed to be taking care of. So I would encourage you to be just a little bit selfish. If we lose cabin pressure, it's okay for you to put the oxygen on yourself first, and make sure that you are feeling well enough to do a good job and take care of the person in the seat next to you. Next, please. I'm very happy to be in contact with any of you. And if you're dying to follow one more person on Twitter, I'm with you, Dr. Wu. Thank you.
Oh, thank you, Dr. Wu. What an outstanding and meaningful presentation. We do have a few minutes before the end of the hour, and would you be up for some questions from the audience?
Absolutely, very happy to take them. I do see one question that was on the chat, something which chat was not something that I said every day or every hour in the past, but the question is about the RISE program guide. So RISE is, there is no guide per se. RISE is disseminated as a full-on training program by the Maryland Patient Safety Center. And if you simply put in RISE and Maryland Patient Safety Center, you can get in contact with them. They disseminate what is a 2-day training program for how an institution can get set up to put together their own peer support program and then get peer responders trained to do the work.
Excellent. We have so many questions from the chat. Here's one for your consideration. Do you see any value in meditation to support our daily patient care practices?
So I think that meditation or mindfulness practices can be surprisingly effective. I think that even the most skeptical individual, when they simply engage in one or another of these practices, whether it be Tai Chi or yoga or mindfulness meditation or breathing exercises, I think that I've never seen someone who wasn't pleasantly surprised and who didn't say, you know something, I feel a little different. I feel a little bit better. So I would encourage people to at least explore whether or not this is something that they should do. we started at Johns Hopkins Hospital. One of our psychiatry faculty who liked this sort of thing started doing Zoom classes with Zoom meditation classes 3 times a day. She got a minimum of 200 people on every class, and literally thousands of people wound up doing this every day, some of them repeatedly.
Oh, fascinating. Here's another question. How can we practice emotional intelligence at work when in reality, our emotions are overwhelming and out of control right now? We want to provide excellent care to our patients, but sometimes our focus is not where it needs to be.
You know, I think that this is, I sort of alluded to this a little bit at the very end of my presentation. I think that taking care of yourself a little bit first is important. I think that if you're not well, if you're not in good enough shape to even take care of yourself, it's going to be difficult for you to have the generosity and deliver the kind of care and caring that is necessary. Many of you do very technical, very skilled work. And if you are not on your game, it can have disastrous consequences. It's almost like what athletes do. You know, there isn't a top athlete anywhere who doesn't have a coach that is a psychological coach. And the job of that person, of that sports psychologist, is to make sure that they are in the right frame of mind so they can perform at the highest level. So thinking about yourself and trying to get there is important. Now, you know, it's not possible to be there at all times. And I think that sometimes you need to take a deep breath, steel yourself, and set your intentions. Say, I'm not feeling great today, but I'm going to take 3 deep belly breaths and remind myself about what the task is that I need to do, and then get it done. And when we're done here today, I'm going to remember to take that walk that I've deprived myself of for the rest of the week.
Great advice. Thank you. Here's another question. As a supervisor, how do you balance supporting your staff through the mental health challenges of workplace burnout, while at the same time ensuring your operational business needs are met?
So, you know, I think that this is a difficult problem. I think that listening to your staff and recognizing and acknowledging what they're going through is something that interestingly makes it easier for them to do the next thing. I think that reminding people that understand that the kind of stress they're under, what that is and what it feels like, encouraging people to, if they truly need to take time off, to do it, and giving them permission to do it, I think is also a smart thing to do. When that person comes back, maybe even after a day, they are likely to be less likely to be displaying the presenteeism that can really poison a workplace, and be a little bit more enthusiastic about working.
Another great answer. Thank you. Here's another question that's somewhat in the same arena as the previous one, but a little different angle. How can we lead students to better mental health during this pandemic? I'm finding it hard to keep students engaged and excited about becoming a healthcare provider during these times. Some are questioning their career choices.
Yeah, some students and some more senior practitioners, I think, are also questioning their career choices. Yeah. I think that confronting it head on, I think, is again important. I think that you can discuss with them what the difficulties that they're witnessing and they are experiencing, and share with them, that in fact, many more senior providers are going through the same things. But explain to them that adversity and dealing with adversity, sort of developing personal resilience is crucial, because you need to have enough in the tank so that you can give your patients everything that they need to. And this is a terrific gift to your patients. We are able to do this despite the stress that it poses on us, and we are some of the few people who can really do it.
Excellent. We have time for a couple more, if you're up for it.
Sure.
Good. Here's one that, what do you think the long-term psychological effects of COVID-19 are on healthcare workers?
Yeah, I think that we should plan for people having continued problems, that I think we're going to have more people exhibiting symptoms of burnout, which can in fact make them more difficult to deal with for us. I think that people who have existing anxiety or depression or other problems are more likely to have those things crop up with a little bit of a vengeance. We'll even have PTSD. I think that we should encourage people to seek any kind of support, whatever flavor of support that they find acceptable. I think that modeling that and doing it together with them can be if possible, can be important role modeling. I think that people have to understand it is natural to be having mental health problems. We're going to be having them more for the very foreseeable future. And it's not only is it okay, you'd be a little bit odd if you weren't having some anxiety and mental health issues.
Well said. Here's a question, has a couple questions in it, but very important. It is hard to support others when things aren't going as usual, and we are mentally and physically fatigued. Do you have suggestions for how we can stay connected with our coworkers and show them support during this difficult time? Also, what can be done to encourage fellow colleagues to seek mental health support instead of suffering in silence?
Yeah, I think that in answer to the second question, I think that approaching people, asking them how they're doing, sharing your feelings, and trying to basically to draw them out is the first step. I think that, again, it is relatively easy to get people to acknowledge that they're worried, that they're anxious, that they're tired, that they're depressed, because this is the new normal. And so someone else seeing them and listening to them without judgment, I think can encourage them to see their own issues and to avail themselves of help. And asking them laying out for them what's available and asking them what they think might be the most beneficial can also be helpful. I think that trying to do things that allow you to get to know your colleagues, to socialize, even if it's only online, with colleagues can be helpful. It's astonishing how, particularly early in the pandemic, how eager people were to get on these big Zoom calls to see their colleagues. And many people said, something, it's very comforting to see all of you again. I've missed you.
Yes, we're finding that as well with our colleagues. Just to see each other is very important. Well, Dr. Wu, we are out of time, and I want to thank you so much for such a powerful and engaging presentation. Your information, I know, was extremely helpful for all those watching, and so I want to thank you very much for your time and your effort, and the best of luck to you.
It's my pleasure. This is a difficult time, and it's very important to have sessions like this. So I congratulate you for getting this together, and all of you for sticking with us for the hour.
Thank you. And for all of you out there, thank you for watching today's webinar. I'm happy to report that we had participants from all over the world today. And so we want to welcome you. Join us for our future mental health series, webinars, and podcasts. Visit our websites for more information.